Hi, Miss Sampson.
Well, good morning. How are you?
Oh, pretty good. I think
Good.
Tara forgot about the one link because she was like, I can't get in. So I gotta send her the link.
Yes.
Oh, let's see. Did you get outside yesterday, Miss Sampson?
No, did you? I should have.
Yeah, I did actually. Once we finished up, it was a huge disaster when we tried to take our test with Miss Kale yesterday. It
Yeah.
it did. I felt so bad. And then Dr. Shine was on too and like trying to help us. But it's just like, and then some people had to get like computers from the school and then those they need, and I felt so bad. So it was kind of a disaster.
It's
But
it's just a icky, rough kind of
yeah,
feeling to make it just be, you know, I I didn't you guys have had more experience doing it. Now seeing, you
yeah,
have multiple tests on it, but
yeah,
I think the first go at it for our class here was okay, other than people weren't able to log in, so it took away from other people's time and such, but it
yeah.
went so yeah.
Yeah. So hopefully I think tomorrow will go better now that we have more of an we've done
Yeah.
it
And
usually just to get that first time out of the way and but yeah, so after all that, then I went outside for a while, which was nice. But
hi Tara, hi Amber.
Hello.
Morning.
Morning.
Nobody needs to see my face right
I
now.
was just gonna say I can't see you, Tara and Amber, which we don't have to for this, but
Yeah,
that's just
no,
because
I
you're
haven't
just
either.
you guys are so good looking and ready that we just can't handle it. So I understand. Olivia and I will be here.
yeah, I guess
You
we'll
guys are
You guys
way
can
more
be the
fun to look
audience.
at.
Well, you know what's cool about this advanced pro thing, putzing around, which now that I got myself off the Hawaiian screen and back onto normal, because they've got a touch up. See, look at me. Look at this. Look
what?
at wrinkles and skin. So you guys can all touch up too. Look at this. Looks like not 50. And I'm like, wow, if I walk around like this all day, that would be pretty nice.
Oh
How
my
do you
So
do
there's
goodness.
advanced features and fun things to
Oh,
check out
Oh yeah, they have it on phone too.
in
wow.
background and things like that. So right, you can all just radiate.
Ah, gotta figure this out.
There's Nina.
Good morning.
Good
Jenna.
morning. And
Morning.
Jenna. Morning, guys. Nina, where are you?
You sure?
Just a virtual background.
Okay.
Oh, see, she's got that figured out.
Yeah, that's funny.
I thought you went someplace. Yeah, I'm gonna play with virtual background again. When I played with it, I got stuck on the Hawaiian screen and
Oh,
my face and everything. So I have more.
I just Googled like Zoom virtual background, and then
Mm-hmm.
you save the picture onto your desktop, and then you can just go upload them.
Yeah,
Yeah, that
that's.
one yesterday was toilet paper.
Oh gosh, yeah. There's a lot of fun ones, and I'm just nervous to play around too much when I just want to get the facts out or get it straight and not cause any more turmoil. Just to have something smooth. So a couple minutes before start time, did you guys take some notes with whitening speaker?
Yeah, not really, but
Oh,
I'm
okay.
being honest, no.
I did. So
oh,
there's
good.
actually, she touched on a lot of things that we touched on in our PowerPoint to review and to go over. Did you guys get a chance to do the crossword puzzle?
I looked at it. I haven't started it yet.
I
though.
started it this morning. I'm like halfway done with it, maybe.
Okay, because that's that's a good review of things to focus on.
Okay.
What's 11 across?
Yeah, did you find it easy, Olivia? A couple of them were tough.
Not easy, but
Find my
The
puzzle
truth.
too. So yeah, in order to get information out without just giving away the answer, you have to have some sort of clue. So remember the series of appointments that we have and what they're titled in the book. What would be another for number 1, number 2, number 3 to help you? You want to focus on what happens at number 1 appointment, number 2 appointment, and number 3, which would be the follow-up.
well,
If you're running a race and you're really good, what place would you be in?
first.
So it's in regards to the series of your appointments.
So the first appointment, you come in to do like a consult.
Med history and stuff.
Yeah, you're gonna make sure that first thing you always do the medical history. Taking your shades, getting things ready. And that's detailed in the book for first. And then the second one is where they're gonna come back and get their instructions, especially the written instructions, because people can hear things many times again and again, and they're either excited, not listening, nervous when it's in regards to like scaling and rip planing, on why we always give something like that brochure, that pamphlet in writing, so they can refer back to it. Hi, Maria, Michaela. So the third appointment is their follow-up and their let's check your shade. Do you need some more appointment?
So number 2 is the written, that's when you give the written directions, right?
Yep. Yep, so let's review whitening and go over what notes from the instructor or the speaker. Hi, Jen. So other than we had some comments on, I would not do whitening after ortho, but otherwise she had some pretty good information out there, good stuff to know. So in regards to whitening, we've got 2 chapters that covered whitening. It's good to know the contraindications. She mentioned those. We had those in the PowerPoint as well as the good ones. Who's a good candidate for it? So what are contraindications to whitening? And this would be vital whitening.
I mean, well, obviously anybody who has like needs dental work, like active caries or like perio disease, things like that. Like we said, we want to make sure they have a good, stable mouth before
You want
we
the foundation first. Yep, and then medical contraindications too. Make sure you're familiar with those too. As far as when we get into Himalaya, into our power whitening. So with power whitening and using that really strong zoom light, there's certain contraindications for that too. So what patients shouldn't have that?
Are you talking like the chemo radiation?
Mm-hmm. So there's that
melanoma.
Yep. So that light that is in the book to review as well, and photosensitivity, all of those things to know too. So
Like seizures, would you not use that on them?
you know, that's a good thought. It's not in the book or so, but certain people who are have seizures or are sensitive to lights can trigger migraines, but I wonder if the safety glasses, the orange safety glasses, would help with that, so it's not so bright. But I actually don't have the answer to that. It's not I would probably, as long as the patient's okay with it, when is their last seizure, have to probably consult with their physician on if that's even a good idea. If they're having seizures several times a week and having issues, that's different than someone who's had their last seizure 8 years ago, but is letting us know, and have to see what the triggers are as far as even people with migraines having light activated sensitivities like that. This might fall into that category. So far we talked about our appointment series. We want to know the contraindications and who's good candidates for it. So she started with talking in general just about stain. So tell me some things about stain.
When we first spoke about it, we said that someone who has intrinsic stains wouldn't really be a good candidate. But when she presented, she says that they can whiten teeth with patients who have intrinsic staining.
Yep, you can. It's different. It depends on who is that candidate or not. If somebody has extrinsic stain that's deeply, deeply, deeply tetracycline stained, they might not be the best candidate, but setting the correct expectations is what you'd work with your provider. If somebody had tetracycline stain but couldn't afford the $1,400 a crown or veneer, then this is something that could be done. Now think of it, this is from a salesperson's point of view and not from an educational point of view. So you also have to know that if someone's going to spend, like at Bassett Creek Dental, it's $180 for the trays, the take-home trays. And offices could be hundreds of dollars more. So you don't want to sell somebody something that you don't feel in your heart and your gut that's going to work for them. So they may get a result, but not the best result. So what are the ideal candidates with stain as far as external stains that still could whiten their teeth? What color of the enamel or habits do we have to be mindful?
Coffee stain.
Coffee drinker?
In the book, there was a paragraph about like yellow, orange, and brown stains, something like that.
Yep.
Yeah.
So most people have a yellow hue to their teeth. Those accept the whitening pretty well. White, of course, white. But when you start getting into orangey browns and the gray colors, they're a little bit harder to whiten.
Okay, so orange, brown, and gray are harder to whiten.
Because the grays are meaning they're tetracycline. The nicest, easiest teeth are the ones that are just that off color, little yellow. I lost my train of thought there. So extrinsic stains, somebody said coffee. So people who are having the coffee and tea, smokers, they're going to pick up more stain than somebody who doesn't use any of those products. So it's setting the expectation for the patient. Remember, we talked about the refrigerator white, and everybody wants that white, but the speaker touched on this too, that you can only whiten so much, that not everybody whitens the same. So you have to get those expectations out there. So extrinsic stains they happen from the outside. What are intrinsic stains?
They happen on the inside of the tooth, such as like what you just spoke about, the tetracycline stains and like fluorosis and things like that.
There's things like that, and there are what the book had. There's extrinsic stains that can be genetic, and then there's intrinsic stains too, to go back and forth with. So if somebody has a stain on their one tooth, number 8, because they got hit in the mouth because they weren't wearing their mouth guard, athletic guard in hockey, and it turned dark. So even though we see it dark, it still came from intrinsically. So they would need to have the root canal first and have that pulp cleaned out before that tooth's gonna look nice and whiten. They still can try external whitening, take-home trays, but they might need an extra boost. And you remember when we talked about the walking non-vital bleach versus non? Okay, so walking bleach was the sodium perborate, which is like bleach, but color safe bleach, different formula. And they would have a cotton pellet soaked into the pulp and they'd walk around with it for 3 to 7 days. So now typically what's done is they'll use the light and light activated and put the whitening after the root canals pulp is cleaned out, everything's cleaned out, and they will whiten from the outside.
I have a question with that one. So when you're using whitening, it's going into the dentin to whiten teeth. So if they clean out the tooth and it's no longer vital, that doesn't matter because basically the dentin is still there. All they took out was the pulp. Is that correct?
Right, and they're probably not going to have
Okay.
any feeling of sensitivity unless it gets on their gum tissues because there's no nerve in the tooth. It's dead. So some people are going to try to whiten it if they're not going to have a crown. Because it's a dead tooth, there's no nerve supply going. It gets very dry and brittle. So especially in a molar, premolar, the best is to put a crown on it to keep it together so they don't fracture their tooth. Sometimes in the front, it can be okay. If they can't afford to do a crown or such, then they might do something like that. So there's options.
Okay.
Okay, so she also brought up what we talked about too, as far as how the products break down and what their byproducts are. So let's review that. What does that hydrogen peroxide break down to?
Urea. Oh wait, no. Hydrogen breaks down to water
Oxygen.
and
Yeah.
oxygen.
Water and oxygen.
Yeah.
And if we use a hydrogen peroxide product, does that tend to be a stronger product or a weaker product?
The hydrogen peroxide's stronger, isn't it?
It's stronger. It breaks down. It's a quicker product. So for somebody who wants quicker whitening, then they may use the hydrogen peroxide in the daytime, like 30 minutes twice a day. Both whitening products, either product, Carbamide or peroxide, can be used in office whitening and professionally. It's just the rate of what a patient wants it done. If they want it done quick and fast, they can do power whitening and they still may need some touch-ups, but they could have more sensitivity with that versus people who have trays of day white. So they do it multiple times during the day, usually twice daily, 30 minutes going in like that. Then someone has night white. So night white is going to switch to the carbamide peroxide, which because it breaks down, it needs more contact time than it does quick action time. What were the byproducts of carbamide peroxide?
Urea
And hydrogen peroxide.
and hydrogen. Yeah.
So then we have that process, and then the hydrogen breaks down, and then we have the next process. So this is a lot of contact time going and continuing to work. So that's why people can wear this up to 2 hours, 8 hours, or overnight. And
would you
different
say
percents.
would you say the hydrogen peroxide is probably more potent than the carbamide?
I think it's more potent quicker, but people will have equal results with both. It kind of goes with sensitivity. You're going to get there quicker if it's going to be in a hydrogen peroxide versus a carbamide, which is going to take longer, but you're going to have longer contact time, so it tends to stay whiter longer. So a lot of the over-the-counter products are carbamide peroxide in there. So the importance is to know the difference, the wear times, know, you already told me about the byproducts going in and just what the components are in there. And she talked about how to load the trays too. And she also talked about sensitivity. So let's go in and review that too. What'd she say about what can we do to combat sensitivity?
Fluoride?
Yeah, so tell me about the fluorides. What are good ones for that?
Stannous fluoride.
So what's another good one? And
Like
we'll go
type
back,
of fluoride.
we'll go back to
Neutral sodium
Stannous.
fluoride.
Yeah, more of a neutral sodium fluoride because we know from our ACP, or acidulated phosphate acid, and composites and whitening, not good. Stannous fluoride, yes, it's okay, but do you guys know what if somebody's going
Staining?
whitening, right? If they're going whitening and they're having the fluoride, stannous fluoride has been shown it stains the teeth. It used to be used a lot in perio. So I wouldn't necessarily choose that one unless it was my only choice, because I wouldn't want to hinder their whitening process. So if somebody's having sensitivity after, what can we put on the outermost layer of the tooth on the enamel to give them some help with sensitivity? Which is also another type of fluoride that she talked about. Prescription strength fluoride. High strength prescription strength fluoride versus 1 parts per million of water, 200 in toothpaste.
Prevalent, 5,000.
Like that. Yep, a Prevident. Theirs is Floridex. Most of those are going to have a 5,000 on them because it's 5,000 parts per million of fluoride is what is prescription. And that works well going through that outer enamel layer into those dentinal tubules to reduce some sensitivity.
So the Prevident fluoride.
It could be any brand.
Okay.
Don't focus on the Prevident part because there's so many brands, but prescription strength fluoride is 5,000 parts per million.
Oh, I see. Okay.
And we
So
should
that's
know that for the test, and like if they're having sensitivity, give them prescription fluoride.
I think you should know that. But we're just studying, we're going. It isn't, hey, Miss Hanson, what's on the test? No, we're reviewing Unit 7, but I'm trying to guide you a little bit. But that's a good thing to know in general, and you'll get a boards question correct because you know that too. Okay, so let's see. What else did she talk about?
How about like loading the trays?
Say again, Maria. Making the
Like
trays.
loading the trays.
Oh yeah, she had that little video. So she showed us, that video was demonstrating what we talked about and what's on her PowerPoint. So how do you how much did you put in there?
Dot.
Just a dab.
Just a
Or a
dab, just
dab.
a dot. Yep. It instead of having your syringe and going, you're gonna waste the product and you don't need it into the back teeth. So it's just a dot at a time. And why don't we want anybody to have any anesthetic while they're doing that?
Because then they can't feel if there's any burning sensation or the irritation to their gums.
Yeah, they can't feel it at all. So that would not be good. So, and just like with your rip planing and someone has sensitivity beforehand, we can recommend something that they would take for their headache. She recommended 600 milligrams of ibuprofen, which would be typically 3 tablets of 200, but you know, whatever they take for their headache, for something like that too. And I kind of liked her analogy. I wrote that down, like the potassium nitrates, which are active ingredients in the Sensodyne and the Floridex, is it helps soothe it. It may not cure it or take it away, but it helps you feel good in the moment. And her analogy was a Valium. I'm like, oh, huh, I don't think I get it, but I don't think I would want to use that as an analogy, which with young people and college students, and encourage that. But it's kind of, it worked. So, okay. Let's see. So she did talk about a little bit more about that Quick Pro varnish that we had in our books that really wasn't detailed as much. So I've never done it before. I kind of want to see that. Okay, so any more questions with whitening?
Yeah, so when you went over the PowerPoint, one of the first slides was regarding like why would patients want it? And I went through the book and you had that little chart up, and is it just because like they want white teeth for aesthetics, or so like the
Basically,
indications?
yeah, basically they,
Okay.
they're gonna want it because they want lighter teeth, but they can't have lighter teeth if there's composites or dental work or the different types of stain that we talked about. They're going to need a conversation if they have tetracycline stain, which she had some really good pictures like that, because we don't see that much anymore. You may see it in maybe your 60, 70-year-old patients, but thankfully we don't see that much anymore. To see if we see something like that, then we're not going to necessarily jump and say, oh, we have this wonderful product and you should buy it. We're thinking of it from an education standpoint versus a sales standpoint. So yes, review the contraindications. Who would need it is basically nobody needs it. It's just
Right.
you want
They just want it. Okay.
Yeah, and none of this will be covered by insurance. It's purely aesthetic. So okay. Now what do you want to talk about?
Can we maybe go through the crossword puzzle?
Sure.
Okay. And then we can just throw out like what we found.
Oh, sure, and it will spark conversation to bring in for other things to bring up too. So, okay.
What's 11 across?
That was in our regards to our series of appointments that we
I got first
about.
number, FIRST.
So I also put first for that one too.
So that's first, because the first appointment, we're going to review the medical history, get our informed consent, make sure they're even a candidate.
And I don't know if you guys are on your phone, but if you click the link that she sent, that it opens up on Microsoft and you've clicked the link on there, it takes you to where she created it. And if you put it in right, it turns green. If you put it in wrong, it turns red. That's been helpful for me.
So then if number 9 down is cervical, maybe. No.
What's another word for cervical?
Gingival.
That was my problem. Okay.
That was exactly my problem too, Amber.
I had to make it work. So same thing, but the book does, it is cervical, but gingival, cervical, little synonym there.
Okay.
So we need to talk about, let's use this to talk about ortho debonding too, because the whitening speaker did a good touch up for our whitening. So I want to save time for debonding questions and for oral appliances, which oral appliances, there is, I don't have the page number, but a wonderful list in the chapter that goes through what each one is for. Know what each one is for.
Know what?
What each oral appliance is for.
Oh, okay.
So we can review that to make sure you know what that appliance is as well. And we're still on the crossword puzzle. I'm just gonna be looking ahead to go in here. Yeah, it's on page 246, table 18.1. I want to go through that and make sure you guys understand what all the appliances are used for.
Okay.
Okay.
I do have one question that's on here. On the crossword puzzle,
Mhm.
number 2, it says, since we're doing the debonding, ideal motion used in one direction to remove the bonding.
Mhm.
I like, it's just from the gingival margin, so like from the cervical third moving towards the occlusal surface or the incisal surface, but I couldn't figure out what motion.
So we're not
Brush like
pushing hard and going like this. Remember, we're going outward. So the book
Yeah.
uses brush like.
So 2 down. Okay, so just brush like. Okay. Got it. Thank you.
Any more questions? Because the puzzle you can work out yourself too.
Mhm.
And then I'm in and out today. I'll be checking my email if you guys have questions. And as always, you can FaceTime me. If you need extra help on something, that's fine. So let's finish with debonding to go through with how are you going to know that there is some bonding left over?
You use air to blow on it, or your explorer to go over it to see if there's a gray appearance.
Mm-hmm.
Solution.
Hi, Paige. So yeah, people's tongues are going to tell that. You've got your disclosing solution, so you typically know it's there, and it's going to be just a dull opaque. It's not going to shine like enamel, because the reason we want it to be debonded in the first place is to get it back to that pre-treatment natural look. And you know when it's there. It'll be exciting to get back into clinic when we've got somebody like that, and you can find it now after we've talked about this too. And then we use our burr, so that's why I put the tungsten carbide in the crossword puzzle.
Yep.
And then after the burr, what do we do next?
Do we? No.
Yeah, and what is like your little pogo? You've got your aluminum oxide, and you're gonna always go from bulk down to thin. So after you use your burr, use your polishing stones, discs, pogo, aluminum oxide, and then you'll beat back down to being able to carry out your polish and fluoride. Let's see. Okay, so let's move away from crossword puzzle because you can refer back to that. And then we've got our chapter on oral appliances.
And you said to know table 18.1, like the appliances and purposes, right?
Yeah, because that's what this chapter is about, oral appliances. So in practice and working, you're going to need to know what these are, as well as on Thursday, you're most likely going to get questioned on a few of those oral appliances.
Okay.
Does everybody understand what the appliances for non-nutritive sucking habits. You can look up one of those online, but it's actually an appliance that a little kid would wear. And there's little spikes here, so when they suck their thumb, it actually is like, ouch, don't put your thumb in there. I've never seen one, but I have had parents who've had to do that, because the reason we want to do that is sometimes you've seen little kids with a very class 2 malocclusion and their anterior is just sticking out, that as you go along in your dental hygiene career, you're going to be able to identify, ooh, that kid sucks her thumb, or oh, that this person has this, or, you know, like I've said before, you're in one aisle at a store and you cross by somebody and you're like, ooh, class 3 perio. You just pick up those things. So this will help hopefully not change the palate skeletal as far as stretching it from being a thumb sucker to be so protruded. And other appliances, they have palatal expanders that stay, they're not removable, that stay in the mouth, that actually expand to more of a permanent retainer type thing. Athletic mouth guards, I think you guys got that one. We've already talked about the whitening trays. Yesterday, the speaker brought up making custom trays too, as far as delivery of fluoride. So that's on our list too. So sometimes after whitening, we need people to have that they can either use their night guard and ortho appliance, or have whitening trays or specific fluoride tray to have that done. We talked about in lecture when people who've got overdentures and different reasons on why we need that fluoride tray, that could be another reason too for the after whitening. Ortho retainers, night guards. Any questions on those two purposes? And periodontal stint. Does anybody, have you seen that, read about that? Any history, seen a periodontal stint? Okay, I will take the cricket sound as nope. So, but perio is it's gonna clue you into that it's some sort of antiseptic in there to help soothe and heal. And sometimes after people have gingival flaps and they have surgically done root planing and they're not in a perio pack, they might do a splint, something of this nature, with maybe some tetracycline based something soothing on there. So that's what a perio stint would be, and that would be made by the perio office. We typically would not have anything to do with that type of material. Same with snoring, sleep apnea appliances. There are snore guards that we make at the dental office, but typically these people are at a specialist and are going to have, it looks like it's maybe 3 night guards thick, and it has hinges on it, but it is, some people swear by it. It gets them in the right position, so they don't, and it can be a pre-step in order for somebody who needs a CPAP machine. And sometimes people wear both. Space maintainer kind of says what it is in its name. It's an ortho appliance that sometimes people will, mostly kids, they had a pulpal problem, needed a deciduous tooth taken out, and it was in one of their molars, and they're 8, and they know that they need this tooth isn't going to be coming in until 10, 11, 12, but they need to keep it in place. They're going to cement a space maintainer in, otherwise the teeth are going to go like this. So it keeps it right in space there. And tooth positioners, that's going to be similar to an ortho office. If they just need a little bit of a tweak, they're going to do something like that. So just to review, make sure that you understand those. And then we talked about the different textures of appliances. So thinking about a custom whitening tray or a fluoride tray, what is the texture of that material compared to a texture you're going to use for, let's say, an athletic guard?
Thickness.
Yeah, I mean, it's gonna be thinner. So
Yeah.
a little more like flexible, I guess.
So that's good to know when you're looking at this, besides the purpose, what are thin, what are thick, and how are you going to make that? How are you going to take care of that? When you're trimming, a whitening tray is very different from trimming a night guard. So if you're trimming a whitening tray, let's say, what would you use to trim that?
And scissors.
Yeah, you can just use a scissors versus hardcore acrylic on a night guard. How would you be trimming that?
Burr.
Yeah, you're going to use like a slow speed and an acrylic burr in there. And most likely the dentist is going to be trimming that too. So thin material, thick material also has different, I guess what I'm trying to say is how many inches, centimeters, millimeters is a thin piece of the plastic versus the thicker thermoplastic material.
0.25 to 0.5 inches.
Wow, got that pretty quick there.
Yeah.
So that's the small one, so thicker. Like the mouth guard ones.
0.5 to 1 inch.
Right, because if we think of that, we have our vacuum and we're gonna put in that material. So if those of you who haven't gotten to see or do this before, turn it on, heat it up, you lift it up. I think of it almost like a waffle maker. I'm lifting it up, I put in my material and I shut it. So if it's shut here, I have to wait for it to sag a certain amount before all of a sudden you turn on the vacuum and you drop it down. And then for about 30 seconds or so, it's going to vacuum form fit right around your model. So if it's thinner, it's going to drop down faster. So we have to be watching that, because if it drops too much, it's too thin, we're not going to have good material, versus a thicker one that we have to drop down in there. So no, on page 251 for fabrication of oral appliance, it goes through the series of how you use the vacuum former and what its purposes for there are. So that's good to know. And you got 252, let's see, it ends on maintenance of an oral appliance. And how long do you think if someone spends, well, night guards could be 600 plus from a TMJ specialist, snore guard could be their $1,000 plus. How long do these last? Average?
Up to 2 years.
Yeah, the book says 2 years. And like I said before, if your pets get them, they love them, and we got to keep those away. But also, what are some reasons why it wouldn't last 2 years for anything? Think of a retainer, a night guard.
Well, didn't we say like sometimes people, when they grind so bad that they just grind through their night guards sometimes?
Heavy grinders can wear them out. Think of children.
So so for the kids, wouldn't it be like stains and like plaque and stuff that build up on it?
It could. It actually, night guards, retainers, they get plaque and calculus on it too. But I'm thinking more of a child's growth pattern.
Oh, okay, yeah.
So they are, it could change every 3-6 months for kids. So typically, for an investment of a night guard or a snore guard or something of that nature, kids under, little kids aren't getting whitening. Typically kids can start getting whitening about 16, 17, but usually 18. But let's say somebody's younger than 18 and they want their teeth cleaned, but we're not supposed to do it under the age of 18. Can a 17-year-old have their teeth whitened?
No.
What if they
Well,
have
they-
parental consent?
Yeah.
I remember the book says 18 and over, but I don't remember anything else.
Yeah, so it's with discretion. So typically it's going to be 18 or older with consent. But the key word is parental consent there. We couldn't have a 17-year-old come into the office and say, I want this, or, you know, something like that. So yeah, so 2 years, if you take care of it, good. But like I said, I showed you guys my night guard the other day, and I have had it for 7 years. So if you take care of it, you're not grinding too much, but it has to get cleaned and such, because I think it's $600 every 2 years is expensive for that. But there are people who grind through it. It's not as expensive as having crowns, a full set of crowns down the way. So a lot of times patients can't afford it. Insurance doesn't typically cover it and make payment plans, but insurances are starting to cover it a little bit more. So that came up in questions before too, as far as us as hygienists, is we don't let insurance dictate what our recommendations are. We will always offer that people have the choice to do nothing, and then give them their options and let them choose. We're purveyors of information and knowledge for them, but they get to choose. So we wouldn't not recommend something because your insurance doesn't cover that. I've had hygienists that I work with as far as fluoride to be, well, we recommend a fluoride treatment. It's $40 and your insurance probably won't cover it. Do you want it? Well, yeah, sign me up. Well, no, they're not going to want it. You have to give them patient specific things on IC decalcification. You have gingival sensitivity, incipient caries, something, and say, make them want it first, explain the need. Just want to let you know it's $40. We submit it to insurance. Is that okay with you? Most people say yes, but you have to believe in your heart and your gut they can really benefit it from that. Just like whitening. We aren't going to just sell whitening if we don't think that they can use it. So with our custom trays too, we want to make sure that we really think that they would benefit from a night guard. Okay. Other questions?
I don't have any more questions.
Okay, so then tomorrow we will have.
Oh, I'm sorry. I was just going to say, can you hear me? I just have a couple questions. I finished primarily most of the crossword puzzle, but I just have a couple questions, if that's okay.
Anybody who, we can go over crossword a little bit more, and then I just wanted to say a little bit about I will just, for those of you who want to stay on, great. If not, I just want to say for Thursday, we will have our exam, and then we will do a review of the final questions, concerns, things of that nature. I'll be, I'm gonna poll people, try that to see, kind of want to see what you guys want for final. I'm assuming you want a review. I'm willing to do something for a review part because I think that's great connection and going, and sure did. Test scores were good, you guys. You did well on Unit 6. So Thursday test, and then we'll have a little bit of review, and then I will most likely schedule a study session probably Monday again in prep for the final. I kind of want to hear from you guys on what I can give to you and what you guys need, more so than me just say, I'm here for you. I got the information, I've got the guidance on there, but I want to see what works for you guys. So if you have,
for the test tomorrow, are we going in those groups again?
I haven't heard that from Ms. E, if we're having the same groups or not. She's got groups that are registered to her. She's got everybody registered to her now, and then it will work the same way as far as logging in, having the passcode, and as long as to make sure everybody's got their computers up going, you've kind of worked some of the kinks out to make sure we're able to start and which computer works. I'll probably touch base with her today and decide about groups, and then we may have an announcement coming out later today, or else we'll see you in the morning.
Okay.
But it'll be groups because we each take half, so
Yeah.
I can see your lovely faces. And you know, and again, you guys, you're on mute, so if you know, if you've got a friend or a spouse or somebody working in there, you have a child or a dog that needs your attention or something, as long as you're just facing the screen, or you can just send a message that of what's going on, so I know that, then that's okay. I know some of you were trying to message me yesterday, but I wasn't able to get back to you on your messages when we were working on getting people's screens up and going. But if we have everybody up and going, I'll be able to see the messages and be able to respond to the messages better too. So if you do not want to go over the crossword puzzle, goodbye, and I will see you tomorrow. If you do, stay. Okay, Jen, what's your question?
Okay, I'm only,
Oh, you're on mute again.
sorry, because I'm trying to go back from screen to screen here. Okay, so I'm only missing 7 down, 12 across, and let me see.
So for 7 down, did you fill in 10 across? And you guys can be on,
Yes, I filled in 10 across. 10 across is intrinsic.
okay. And
Mhm.
that is correct. So 7 down, appointment for the second, for the appointment for the follow-up, touch-up, and
Yeah.
post-up shade.
It's definitely not recall. I tried that.
Third.
No. So your first appointment, then your second appointment, and your third appointment is the follow-up and the touch-up and the post-op shade.
See, you guys got me used to all these fancy words now. And now. All right, perfect. And then I'm just missing 12 across and 4 down, and that's it. But I have everything else filled in.
Okay, so 4 down. Nope, don't people say the answers either. So 4 down, remember when we are trimming the models and we have this nice old perfect model. Think about if you have the model and you're in it for the stone, on how much stone that you had to trim away. So the book said that there's a certain shape that you can have it be in for trimming. Like a U. So we can tell you, but just to make sure, just to look and to know that it's going to be a horseshoe shape. It's not going to be a normal base on there because that's going to be too much to trim away. So we're not having a traditional base on that. And then 12 across, was that a question?
Yeah, I didn't have 12 across either.
So what do we do to return enamel to a natural pre-treatment state, thinking about unit 7, if somebody has resin or composite stuck on their tooth?
Debond.
So we debond, and then we're going to add an ing on that because that meets up with 8 down resin.
So it's just debonding then?
So it's just debonding.
Oh, okay.
So we were just overthinking it pretty much. That's what it feels
right,
like.
I wanted to do an easier, low-key review. Informational, but not too much thought. So even though you know the answers to these crossword puzzles, if there is, let's see, I want you to go more than just knowing the answer to this crossword puzzle, because if I said, like resin material dimensions for whitening trays, or well, I guess what I'm trying to say is just because I asked this question doesn't mean I'm not giving you answers and test questions here, but it's to prompt you to think about the information surrounding it. Like if it is a first appointment, you also will know what the second and third is. If we put in athletic mouth guard, then I want you to know what the periostint is or a space maintainer is. So it's giving you clues to understand and know what to look for. Does that make sense?
Yep.
So from the wonderful notes that you all took from the whitening speaker, that, the crossword puzzle, and your PowerPoints are going to give you good information and tools for Unit 7. And also just slowly reading the question, looking at the STEM, deciding which answer then would make the best choice. Good? Okay, so
All right.
email me if you need additional help, additional questions, and then we can have FaceTime. And right now I'm going to go check on my son who his Schoology crashed and he had to watch a video on, now students, we want you to still brush your teeth and wash your face and get dressed. Do your normal routine. As then there was a new word coming out of his mouth and he's sitting in his underwear and a t-shirt down in the living room with a dog and a parrot on a laptop. And so I'm like, get done, boy. So everybody, we're all going with it, making changes and just flying. So sometimes we just have to take a breath and just, it is what it is. So make sure you take some time for yourself today. You will get a test. It is going to get done and we will get through it because we're tough and we can, because we're going to be dental hygienists and they're tough. And they
Yes.
fly by the seat of your pants and you're smart and you can do this. It's especially now how you all are going to be such wonderful multitaskers by the time you get back into clinic after dealing with all of this and life and etc.
I have a quick question before you leave. Is Miss E going to, or are you going to do any highlighting in the book?
Ms. East is highlighting, and I believe that she had all of the chapters highlighted unless there was chapters she needs to go back to. So we can check on that too.
Okay.
But I think she had up to Unit 6 done for highlighting. I'm not sure about Unit 7, but
I saw some highlights on there.
because I think
when I was on
she
there.
sent out an announcement that she's completed highlights in the book, which is another way of steering you in the right direction too, but same as what you've already done, Nina. You had it in the right direction.
Okay.
Okay, guys. Study
All right,
hard,
thank
relax.
you.
We'll see you tomorrow.
Thank you, Samson.
Yep,
Thank you.
bye,
Thank
guys.
you.
Thank you.